Today, we're going to talk about a molecule with a fascinating, kind of wild story. One that's gone all the way from ancient rituals to the cutting edge of modern medicine. Yep, we're diving into psilocybin. And really, the huge question that's driving this whole new wave of research is this. Could magic mushrooms actually be a legitimate treatment for something like depression? So, this right here, this is the molecule at the heart of our story. It's the psychoactive compound you'll find in more than 100 different species of mushrooms. And for centuries, people have used it for, well, everything from spiritual ceremonies to healing rituals. But to really get where it might be going, we've got to look back at where it's been. And trust me, it's a complicated past, stretching from sacred ceremonies all the way to legal prohibition. Okay, so this timeline really lays out psilocybin's wild ride. I mean, it starts centuries ago, used by indigenous peoples in Mexico. Then, in 1958, Albert Hofmann, yep, the same guy who discovered LSD's effects, he isolates it. In the 60s, it was even sold under the name Indocybin for research. But then, the culture shifted. There was a major crackdown, and by 1970, it was labeled a Schedule I drug, which basically slammed the brakes on research for decades. So how does this little molecule actually do what it does? What is going on in our brains that creates such a powerful and sometimes life-altering experience? Let's get into the science of it. All right, here's the first thing you need to know, and it's a big one. Psilocybin itself doesn't really do much. It's what's called a prodrug. All that means is that our body has to do a little chemistry project on it first to unlock its real effects. And this is how that magic happens in your body. Once you ingest it, your liver gets to work and basically chops off a part of the molecule. When it does that, it transforms psilocybin into the active compound, which is called psilocin. So, get this? It's not actually psilocybin that crosses into your brain and affects you. It's psilocin. So once psilocin gets into the brain, how does it work its magic? Well, it's all about being a master of disguise. If you look at the structure of psilocin, it's incredibly similar to serotonin, which, as you probably know, is a super important neurotransmitter for regulating our mood. Think of it like this. Psilocin is like a skeleton key that just happens to fit perfectly into serotonin's lock. And this is the absolute crux of it. Because they look so similar, psilocin can just slide right in and bind to our brain's serotonin receptors. It seems to have a special liking for one in particular, called the 5-HT2A receptor. And scientists believe that activating this specific receptor is what kicks off those profound shifts in perception, mood, and thought that we call a psychedelic experience. Okay, we've gone deep on the science, the molecules, the receptors, but what does it actually feel like? So, a typical journey, if you will, lasts somewhere between 4 and 7 hours, and it moves through some pretty clear stages. You've got the onset, then a come-up period where the effects build, a peak that can last for a couple of hours, and then a gradual come-down. And the experience itself? It is a total spectrum. On one end, you have these incredibly positive effects, things like a deep sense of empathy, the dissolution of your ego, music sounding more amazing than ever, and this powerful emotional release. But, and this is a big but, it's not always a walk in the park. Adverse events are also common, stuff like anxiety, nausea, confusion, and sometimes really intense feelings of fear. And when I say profound, I mean life-changingly profound. Just listen to this from a major study. 67% of the participants rated their psilocybin session as either the single most meaningful experience of their entire life or in the top 5. We're talking right up there with the birth of a child. Okay, but we have to be super clear about this. That's in a controlled clinical setting. Out in the real world, without that support, these challenging experiences or bad trips are pretty common. One survey found that about 11% of people who had a bad trip said they put themselves or someone else at risk of physical harm. So the environment and psychological support aren't just helpful, they are absolutely essential for safety. And that right there brings us full circle. Back to today, and this incredible renaissance in research. Scientists are looking at psilocybin not as a party drug, but as a serious potential medicine. And the early results from modern research? They're honestly pretty staggering. Early studies are showing real potential for helping with some of our toughest health problems. Things like addiction to tobacco or alcohol, treatment-resistant depression, and even the crushing anxiety that can come with a terminal diagnosis.
Get this. In one study on smoking, which we all know is incredibly hard to quit, a full 80% of the people who went through psilocybin therapy were still smoke-free 6 months later. 80%?
And for cancer patients facing the end of their lives, a single dose of psilocybin gave between 60 and 80% of them immediate, substantial, and lasting relief from their anxiety and depression. We're talking effects that were still there 6 months later. And here's one of the most fascinating parts about how it might be working. Researchers are finding that the more intense and meaningful that mystical experience is for the person, the better their long-term therapeutic results are. The experience itself is the therapy. It suggests that this works by creating an opportunity for a profound psychological shift, a chance to completely reframe your life and your problems. But, okay, let's pump the brakes for a second. The road from these amazing studies to an actual approved medicine is, well, it's long and full of roadblocks. Its Schedule I status makes research incredibly expensive and slow. There's almost no federal funding. And think about it. How do you even design a proper double-blind trial when it's pretty obvious who got the drug? These are significant hurdles. So where does all this leave us? We have this incredibly powerful substance with a rich, complicated history. It has what looks like unbelievable therapeutic potential, but it's still tangled up in a complex legal and social web. Will psilocybin finally make that leap from a dark classic to a mainstream medicine? That's the big question everyone's trying to answer. Thanks for joining us.